This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello, I'm Peter Anthony Holder. Welcome to this week's edition of Your Health. Most people know that they have to go for regular checkups of their teeth through the course of their life. But how early should those visits start? Well, the answer is very early. As an infant, when you start developing teeth, you need to be regularly checked by a professional. One place you can visit is Clinique Baby Dents at the CLSC in Côte-des-Neiges and the CLSC in Park Extension. To talk about proper oral hygiene for your infant, we are joined by Isabelle Daoust, a public health dental hygienist with the Integrated Health and Social Services University Network for West Central Montreal. Isabelle, how early should a child first get their teeth checked?
The Ordre des Dentistes du Québec actually recommends at the latest 12 months old or 6 months after the first tooth has erupted.
At that early age, what are you looking for or trying to prevent?
We're trying to prevent cavities, obviously, and we are actually looking for the starting signs, beginning lesions. They could appear as early as 10 months old. And as everybody knows, it starts small. A cavity never just shows up, boing, a big hole like this. It begins small. And when it's still small, we can have an impact on it. So that's why we want to get those as early as possible.
What causes cavities in children? It's not like you're usually at that age loading them up with sugar and the like. So what is the cause?
The causes are actually the same causes as in adults. The very quick recipe for a cavity, you actually need 3 ingredients. You need bacteria, you need sugar, and obviously you need teeth. Now, if a baby is only drinking milk, whether it's breast milk or in a bottle, there still is sugar in the milk. And this, not too many people know about this. So if you're drinking milk and unfortunately your parents passed on their bacteria to you, being a baby, and you got teeth, you're at risk.
How often should a baby start going to the dentist after they first go?
As often as possible, at least every 6 months if you're not at high risk, and sometimes more often if you are at high risk of having cavities.
And how different is their dental visits from older children and adults?
Very good question. Well, we actually don't use so many instruments, the ones that we're used to seeing in a regular checkup, and we put the children on our laps. It's called the knee-to-knee technique. So instead of trying to hold on to the baby on the big chair there, we just sit knee-to-knee with a parent and lay down the child on our lap to have a better look at the teeth and the mouth.
Well, I was about to ask, many adults don't like to go to the dentist, unfortunately. So what's it like with young children? How do you calm their fears and keep them keep them still long enough for the procedures?
Well, babies only have a few teeth. Unlike adults who have 32, it takes much longer to look at 32 teeth than 4 or maximum 20. So that's the first thing. Second, of course, baby will cry. For some reason, they're not comfortable, and it's not like we're hurting them or anything. We brush their teeth and we have a look, which is a good thing that they cry, because when they're crying, they open their mouth real big, so we can have a look much more easily.
I was reading a statistic that says 42% of children starting kindergarten have had early childhood tooth decay. That seems pretty high. Do you think not enough children go to see the dentist early enough or often enough?
I don't think it's so much that they don't visit the dentist, but that the parents don't really know how to take care of baby teeth. That's the most important factor here. As soon as the first tooth is in the mouth, we should start brushing it using fluoride toothpaste. Of course, watching what we feed our children, whether it's drinks or very sweet foods. But sister, as early as possible, we should start brushing, and it will avoid a lot of problems.
As the children develop more teeth, how early, if at all, should you start flossing?
Great question. The answer is very simple. As soon as the teeth are in contact, as soon as the teeth are touching one another, that's when we should start flossing.
What role does early dental care play in setting up children for the permanent teeth that will come out later?
Major role, because it becomes a habit. Taking care of their teeth just gets integrated into their daily routine, and that is what will make the biggest difference for later on.
As far as dental hygiene is concerned, is there a special type of toothpaste different from what the parents will be using when they're brushing their children's first teeth?
Great question. You ask good questions, Mr. Peter.
Thank you.
Actually, as for the fluoride, it is the same as the amount we can find in an adult toothpaste. There are two main differences. The first one being the taste. Of course, us adults, we use minty, strong, itchy toothpaste, and also the abrasives. Adult toothpaste are more abrasive than children's.
When going to a dentist for the first time with a baby, does one simply call and get in contact with services like yours, or do you go through the pediatrician first? Is there a process one must go through when going to the dentist with a baby for the first time?
Well, first thing I would suggest is to ask your family dentist if he or she works with babies. You call, you make an appointment, and the great news is exams are covered by the Medicare card here in Quebec. Once a year, they're free until 9 years old inclusively. So first thing I would do, I would suggest that you call your dentist, and if your dentist does not work with babies, then you can ask the dentist if he would have a referral or come see us at the CLSC.
We all know what happens to teeth later on in life. You people, especially with the younger children, you end up getting corrective things like braces and whatnot. Is there anything that has to be done to a baby that is corrective on their teeth, even though those teeth are not permanent ones?
We can be on the lookout. Obviously, we can see some things that could affect the adult life. Unfortunately, the treatments don't really begin until the age of 5, I would say. But one behavior that we will try to help the parents with is sucking the thumb. This can really create damages in one's mouth, and so we try to support parents into reducing those behaviors.
What about pacifiers?
What about pacifiers? Well, first, as a hygienist, I would much rather the child has a pacifier than sucks his fingers, because it's much easier to get rid of a pacifier than it is of a thumb, right? The latest studies show that we could go until the age of 5, and that only with the natural mouth movements that the teeth could go back into place. But the pacifier, yes, the children need it. I recommend by the age of 3, we could start working on it. And please, 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 no dipping into honey, no dipping into sugar, just the plain plastic pacifier.
And as you know, some adults grind their teeth when they sleep. Is this a problem for babies? And if so, what can be done?
Yes, many children will grind their teeth. Parents can actually hear them. It's a problem that usually solves itself when the adult teeth start coming out around the age of 5 or 6. If it doesn't go away by that age, please consult your dentist.
So again, most important point here, children should start going to the dentist around the age of 6 months. Basically, when they first start developing teeth, they should first start seeing the dentist.
Exactly.
That's Isabelle Daoust, a public health dental hygienist with the Integrated Health and Social Services University Network for West Central Montreal. As Isabelle suggested, you can consult with your dentist to see if they take in infants as patients. You can also visit Clinique Baby Dents. They have clinics at the CLSC in Côte-des-Neiges and the CLSC in Park Extension. For more information or to make an appointment, you can call the Côte-des-Neiges CLSC at 514-731-8531. That's 514-731-8531. The number for the CLSC in Park X is 514-273-9591. That's 514-273-9591. And that's it for this edition of Your Health. Again, we remind you, if you missed any of our previous programs, you can find them archived on our website. You'll also find there all the information, such as links or phone numbers that we've mentioned in this show. Also, feel free to drop us a line if there is a topic or area of discussion that you'd like us to explore on future shows. I'm Peter Anthony Holder. Thanks for joining us.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Join us next week for another edition of Your Health.